Nick Ferrari at breakfast on LBC. Call 0345 6060 973.
9 minutes before 8 is the time. Right, let's come away from Abu Dhabi and the conversation about who did or didn't win the Grand Prix and on to far more grave matters, which is this ambition. I'll give you those numbers again as spelled out by one of the newspapers. 18 days, 22 million jabs. Health Secretary Sajid Javid joins me now. I understand the need and I recognise and admire the ambition. Is it deliverable, Secretary of State? Good morning.
Good morning. Look, I hope it is, Nick, and we're going to try our very, very best to do this. And let me explain just very quick why we're having to do this, why it's become so important. In the last week, we've learned two really important things about this new variant, Omicron. The first is that it spreads at a phenomenal rate. The number of infections are doubling every 2 to 3 days. It means we are going to face a tidal wave of infection. Already in London, it's gone from almost nothing to around 40% of infections. Second thing we have learned in the last week is that 2 doses of the vaccine are not enough to protect yourself against this variant. But 3 doses, a booster shot, it gives you excellent protection against symptomatic infection. The booster program in the UK was already the biggest in Europe, over 23 million boosts already. But we now need a new national mission to get as many people boosted as we possibly can. And that is why we are opening it up today to all over 18s so that they all have a chance to get their booster shot before the new year. And we're going to do this by opening up even more vaccination sites, mobile units and pop-up units. We're going to extend opening hours and the opening days. We're going to ask GPs and pharmacists to do even more. And we even brought in 41 military planners across the country to help with the coordination. It's a real big new national mission to get boosted now.
I wish you nothing but success, but have we got enough trainers? And you'll have done the numbers, Secretary of State. The best figure attained before this was 850,000 in March. It's quite a leap that you want day in, day out for the best part of 3 weeks, Secretary of State.
It is. It's huge, and we don't have today. If you ask me right now, do we have all those extra vaccinators, the people to help in the vaccination centres? Not as of this morning. They're not all suddenly there from just from the moment we announced this. Of course not. But we are bringing in thousands of more people, including civil servants, more military personnel, as well as the volunteers. But also, we are going to have to, as the Prime Minister said yesterday, reprioritise within the NHS. Already people there doing phenomenal work by asking GPs for the next couple of weeks to focus only on urgent cases and to do more with vaccinations. And also we are going to have to cancel some non-urgent appointments in the NHS and postpone them out until early next year so that we can focus our efforts on what has become absolutely crucial, because we are in another race against the virus and the vaccine, and we must get more booster jabs out there without delay.
Just to clarify, you said you're bringing in more civil servants. Is that on the admin side, or is that to actually are you training those folk to be vaccinators as well?
Some will be. Others might be anything from car parking duties to taking people's names or giving advice, whatever it takes. We are throwing everything at this. We have not done anything like this before with our national vaccination program. It is completely new. But we just didn't want to not have tried this, and I think it will be a success. I can't sit here, of course, Nick. I'm not going to sit here and pretend that all those jabs, the numbers you mentioned at the start, are going to be done, because it depends on many factors, not just what we can do in terms of capacity, but people to come forward. And I would just please, Nick, if I may, just say to your listeners now, look, booster shots, they were important before, but they have never, ever been so important. This is our best way of dealing with this new variant. And please do come forward to protect yourselves, to protect your loved ones and your community.
There have been reports, Secretary of State, that the extremely vulnerable sector, situations or conditions such as blood cancer, might require a 4th vaccination. Can you confirm or deny whether that's the case?
Well, we already announced that, I think it was 2 weeks ago when we first learned about Omicron. The advice from the JCVI, that's our expert advisors on vaccinations, was that for those people that are immunosuppressed, that have been taking the vaccine, they had already been offered a third dose as part of their primary course, but it is now recommended that they also have a booster dose as long as it's been at least 3 months since their third dose.
All right.
The other thing I will say, Nick, that I hope will act as some reassurance to anyone in that group being extremely clinically vulnerable, is that we now also, as a country, we have antivirals. So they're different, they're medication, but different, of course, to vaccines. And we are starting to use those this week. So if anyone that is clinically extremely vulnerable does become infected by this new variant, they will be, the NHS will know who they are, and these antivirals will be given to them.
Coming back more broadly on the fight against Omicron, yesterday your colleague Nadim Zahawi seemed unable to rule out the closure of schools. Surely we can say we don't want to go back to that, not just for educational reasons.
No one wants to go back to that. No one wants to go back to so many other things that we've done in the past. And it's important, though, I think the measures that we have announced, that we pursue those, the extension of the face masks, the work from home, for example, that's starting today in guidance. But the most important thing that we can all do is the booster program. That is our way out of this. And the vaccines were already working. We were winning in that race against the vaccine, with the virus versus the vaccine. But we now have been thrown off course a bit, I think it's fair to say that, because of this new variant. And we need to get back on course and start winning with our vaccines again. And it's the booster program, this new mission to get boosted now, that's going to do that.
My question is whether we can rule out the closure of schools, of course, Secretary of State.
Well, look, I don't want to see that or any of these kinds of measures. I'm just going to focus on everything else we need to be doing, especially the booster program.
So we can't rule it out, just so that many parents...
I think I'd say this, Nick, and in that if you're asking me for guarantees, I will just say, as the health secretary, of course, I'm not the education secretary, as the health secretary, that there are, when it comes to our fight against this pandemic, there are no guarantees. But what we do know that works is in this case a booster shot of the vaccine. This vaccine still is incredibly effective with a booster shot, and that's why we're so focused on it.
Staying with the measures to combat this, of course, tomorrow there's the crucial vote on what's been known as Plan B. There does seem to be simmering more tensions within the Conservative Party, even reports of some 60 people, rebelling. What would happen if there were a number of junior ministers who resigned? How would that look for the government, Secretary of State?
Well, look, let's wait and see what happens. Of course, there's always, with any measures, there's debate across Parliament. There's a number of my colleagues that have expressed their concerns around one of the measures in particular, which is a requirement that if someone goes to a nightclub or a large event, that they're asked to take a negative lateral flow test or be vaccinated. I think that's a perfectly reasonable ask, but there are many people in Parliament that still want to be convinced, and it's right that they are given the time that they need and any data, anything that might help them to reach a decision.
All right, lastly, I have to ask you a question. You told me you were upset by the video concerning the party in Downing Street with Allegra Stratton and others. How did you react when you saw on the weekend a party, albeit a Zoom party, in which the Prime Minister took part, Secretary of State?
Well, what I saw there in that photograph was the Prime Minister sitting at his usual desk, taking part in, I don't know for how long, but I understand it wasn't for that long at all, but taking part in a virtual quiz. And so that's what I saw. I didn't see any party or anything like that. That's what I saw. But what's more important is not really what I think of a single shot in one photo. It's this investigation that's being conducted by the Cabinet Secretary, Simon Case, and he can look at whatever he wants. He can gather evidence, and I don't want to jump to any conclusions. I'll be interested in the facts.
Right. Labour MP Neil Coyle says it needs to be the police that's investigating all these parties. Lastly, Mr. Javid.
Well, the police are operationally independent, and it's up to them what they do.
Grateful for your time, Health Secretary Sajid Javid, appearing on LBC. Good luck with your ambition getting those jabs in the arms. LBC, 8 o'clock, news is next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, the targets to give every adult in England a COVID booster vaccine has been brought